able to sell these medicines to the general public. We have services of the optician. In case you have challenges with seeing far or near, you can also visit us, and our specialist checks or assesses your vision. We also are able to offer all lab tests in our C lab. We carry out both the common tests and the ones that look rare right here at Arua. These are some of the services we are able to offer.
All right. Thank you very much, Dr. Felix, for giving in your time and also to the facility. We don't take that for granted. And also our viewer, keep on. We have more exciting yet to come for you. And our topic of discussion today is going to rotate about kidney failure. However, doctor, before we go into what kidney failure is, a viewer outside there may need to know what is a kidney and what are the roles these kidneys play before we look into the topic of today.
I want to put a disclaimer. We health workers, we do not steal kidneys. That has been trending. And some people want to sell kidneys. No, this is a precious organ. But a kidney, all of us have kidneys. At least each person has 2 kidneys. There is the right and the left. That's a normal person. But we have circumstances where you find one person has only 1 kidney. Now, when we look at the kidney, it's a bean-shaped organ. It weighs about 20 grams. Then, when we look at its outer covering, it has a part we call the cortex. When we go inside, we have what we call the medulla. Then where we have urine production, we have, and where the urine collects, we have the renal pelvis. And then the kidney definitely is part of the upper urinary tract. This then connects to what we call the ureter. However, they are supplied with blood from a large blood vessel, which we call abdominal aorta. I think this is this can be of much help for you who is listening and viewing us at the moment.
You have taken us through how precious this kidney is. However, viewer may need to know, what are some of those other specific roles these kidneys play?
When we look at the roles or the functions of the kidney is a very important organ of the body. The first important role it plays, it's excretion. This is removal of any wastes from your body, which involves filtration and secretion. I just want to give a scenario. We all know a funnel. So the kidney behaves like a funnel. It helps us to filter wastes. There are large molecules that do not come in the wastes. We shall see it ahead, like the proteins, and then we also have other cells. Blood cells are not supposed to be in your urine. There are other roles that the kidney plays. The kidney also plays roles in blood production. It stimulates erythropoiesis, which means blood production. The kidney produces a hormone we call erythropoietin, which does that role. The third role the kidney does is acid-base balance. You know the way God has created us. The body has to have what we call homeostasis, that the balance of the internal environment. So the kidney helps to prevent acidity or alkalinity of the body. The other role the kidney plays a very important role in controlling your blood pressure, because it also produces a hormone we call renin, which is very important in controlling blood pressure. And finally, kidneys also are very important in water and electrolyte balance. These are some of the roles, our dear viewers.
I believe the viewers are getting an image of how important or crucial your kidneys are, because actually the viewers could be knowing maybe the kidneys just for urine as excretion. However, you have given us other roles these kidneys play. Then you have shown us how important and crucial these kidneys are. Now let's go into our today's topic. What is kidney failure?
Kidney failure is I believe all of us have heard the word kidney failure. It's synonymous with the word kidney disease. It's any damage or injury that compromises functionality of the kidney and its structure. And this damage can either be short-lived, maybe below 3 months, or beyond 3 months. That changes the way the functions I've already informed you at the beginning. It will prevent the kidney from performing those roles we have just shared. That is kidney failure or kidney disease.
You have gotten to understand that it's an injury which goes to the kidneys. And I heard you say it could be 3 months, less than 3 months, or more than 3 months. Could this kidney injury have classification or maybe types?
We have what we call acute kidney injury. This is an injury to the kidney which is reversible, and this causes reduced functionality of the kidney. However, this takes place in less than 3 months. That's the first classification. The second classification is the chronic kidney disease. For this one, it is most times irreversible, and this is a prolonged damage to the kidney that occurs in a space of more than 3 months, and that's why we call it a chronic kidney disease.
The viewers have gotten to understand that this kidney failure has classification 2 types. Then a viewer outside there already is worried. You have shown us how crucial and important the kidney is.
Yes.
You have shown us that if maybe there is any issue, we could get a kidney failure. What are some of the things our viewers and the community could be doing which could put them at risk or which could cause them to get this kidney failure?
When we look at things that we are doing around us that can predispose you to a kidney failure, we are going to look at this at 2 categories. We have things that are within your control, which we call modifiable risk factors, that if you continue doing that, it predisposes you to a kidney injury or kidney disease. Then we have also the non-modifiable. Let me start with the modifiable ones. The modifiable ones are our day-to-day behavior or lifestyle. I will start with a common thing we the youth are doing. We do smoke, we do shisha, we do cigarettes. Unfortunately, some do cocaine.
Even alcohol.
Even alcohol is one of the practices that predisposes one to kidney failure. The other thing is consumption of salt. You find that there is a practice where we do, people always add salt into food even after it has been cooked. In the long run, these salts carry impurities, and it will make it hard for the kidneys to excrete them. Then there are things also still modifiable because they are important. These are comorbidities or diseases which are still under our control. For example, those with high blood pressure, for those with diabetes, those with HIV, those with recurrent UTI, urinary tract infections. All these predispose you to kidney injury. Maybe let's look at some of the non-modifiable factors. We have male and female, but for kidney disease, its burden is equal in both male and female. Then we have the other factor, age. When one is growing, there is wearing out of cells. There is apoptosis that comes in and cells begin to die. So we shall also have a reduced functionality of the kidney. We equally have genetics. Those with history, family history of kidney failure, kidney disease, that also predisposes one to it, because there are genes that can be carried in families, generations and generations, that can predispose one to kidney disease.
Maybe what I've noted, this one has been different, like to sex. It's equal on both sides and males, because last time there is a discussion we had with Dr. Tony about stroke. He said the men. So now today it's all sexes, like sharing the same risk factors to get this illness. However, maybe to ask people outside here, actually let me say here in West Nile, they love drinking alcohol, they love smoking, shisha. Could you maybe try to illustrate for the viewer outside there how such behaviors could lead to the development of a kidney failure?
When we do take cigarettes has I should say contents. We have nicotine and tar. And what this does, it causes vasoconstrictions, means it causes narrowing of our blood vessels. Remember, I took you through the blood vessels. The kidneys are supplied from the abdominal aorta. So when it narrows that, it means the kidney will not be supplied with blood. We shall therefore have what we call ischemia come in, and this will lead to inflammation, and this inflammation is what we call an injury. This is how the kidney injury will come about.
The viewers, you have gotten an image or an illustration on how maybe excessive drinking of alcohol, should I say excessive?
Yes,
okay, because you never know, viewers may say they may need to take some. And also cigarettes, how they could escalate or lead to the development of a kidney failure. Maybe also, doctor, to ask a specific question. We have seen people in the communities engage in physical, let me say, battles or maybe fights, and maybe they get heavy blows, maybe in the chest and maybe in the abdominal region. Could it also lead to kidney failure? Because I've had a friend who has been a victim of such circumstance.
He has asked me about a blow. Definitely, when one hits you a punch in the abdomen, it will crush the kidneys, and therefore that results into most times irreversible damage of the kidney. But I also want to inform us, the viewers, that we have other specific causes of kidney injury, which is also good for you to know. Like we have causes. Let's look at the kidney like a house. Means we have a water pipe supplying the house, and then we do wash clothes, we do wash plates, we use it in the toilets. Then there is another pipe that has to take it to a lagoon or a sewer. So we have what we call the pre-renal causes, means causes before the kidney itself. And these ones also, these are important when we come to management, because we are going to look at hypovolemia, means anything to do with reduced volume of blood. This can result from vomiting excessively. This can result from diarrhea, which usually we suffer from. And then also when one has an injury, just like the way the moderator said, and one bleeds excessively, either internally or has had an accident, that will lead to hypovolemia. These conditions also lead to dehydration, and these are direct causes of kidney failure. We have some other things we call hypotension. This is like a cardiogenic shock, means the heart is failing to pump blood to supply the rest of the body. Little blood is being pumped out of the heart. This will cause hypotension. The kidney thrives well, and we prevent injuries when it is being perfused with enough blood. We also have instances where we do operations and we give a person anesthesia. These are medicines to make you sleep. These also lead to, in the long run, can cause kidney failure. Let's look at renal causes of kidney failure. These are quite many. The infections that keep affecting us, which range from UTI, the urinary tract infections, can progress and affect our kidneys. Then we equally have drugs that we use on day-to-day basis, like NSAIDs, non-steroidal anti-inflammatory drugs. For example, ibuprofen, which are common painkillers we use.
Yeah, actually, when people self-medicate in the community,
yes,
they get that ibuprofen as a painkiller.
Yes, so all I can say is let's avoid self-medication. Take medicines after a prescription from your doctor or a healthcare provider. I also want to say that there are investigations we do which involve contrast media, like barium swallow, barium meal. These ones we do them especially when somebody has had a chronic pain on the GIT tract, on the gastrointestinal tract. We want to find out what could be the problem. Is there an obstruction? These contrasts have to be eliminated through the kidney, and constant exposure to them also can predispose us to kidney failure. Finally, I also want to talk about obstruction. Remember, I gave us a picture of a house that has to be drained with a pipe to the septic tank or a sewer or a lagoon. There are things that cause obstructions. We have pelvic masses. This can be both in the female or in the male. For example, if we have ovarian cysts, we have fibroids, they can compress on the ureters, and urine will not drain into the urinary bladder. We equally have in men, those who are above 50 years, we have the prostate gland. It usually enlarges, and when it enlarges, since it is around the urethra, which has the tube that has to bring out urine, it can also obstruct. When it obstructs, this urine that collects can backflow, and this can cause kidney failure. You have actually given a detailed way on how a person could get a kidney failure, maybe, let me say, kidney failure. And I know the viewers outside there, they are taking note. If they're involving in such risky behaviors, to say, they will pick on and maybe start dropping such behaviors. Now, maybe, Doctor, as we almost come to the end of the first segment, we assume someone has gotten maybe physical engagement, they are fought, maybe they got blows on the abdomen, or maybe someone has been smoking or drinking alcohol for a long period of time. How could they know or start suspecting that they are having a kidney failure? We actually, let me paint the picture. Over 90% of the population will not be aware that they have started developing a kidney injury, which can lead to a kidney failure. Means they are asymptomatic. However, this problem is broad. For I just want to say about 13% of the world population is affected by kidney injury. And in Uganda, to be specific, 1 in 10 adults who visit our facilities, seek care, and others have a kidney injury that has started. Before I respond to your question, I just want to paint this, that 40 to 50% of hospital admissions are for people who have acute kidney injury. And mostly 50% of these people admitted in ICUs end up having kidney injury. How one can be able to know that they really have a kidney injury? One, the commonest, by the time we see these signs and symptoms come, means we are moving from mild, we are moving from moderate, we are now at moderate and progressing to severe kidney failure. There will be swellings of the lower limb, the body. Remember, we talked of water and electrolyte balance. The whole body will be swollen. It can be your face, it can be your arms, your legs, it can be your trunk. That's a common sign. The other signs one can know is there will be excessive thirst. When we looked at the risk factors, vomiting, diarrhea, this will deplete water from your body. So if you're thirsty, we need to check you up. Then the signs one can know that they're having kidney failure. It will be according to the system that is involved, and will be according to the risk factors we've already looked at. Most times, a person will come with fatigue, generalized body weakness. A person can come with abdominal pain. A person will come with a poor flow of urine. It can be dribbling, it can be a poor stream of urine. It can be when you want to urinate, the urine is not coming out. We have to start thinking of what is that causing this kidney failure. These are some of the things we can be able to identify at home, and then we'll be able to inform you to visit your healthcare provider.
In case maybe you have been a victim of these activities, you warned us about which could predispose us or put us at risk of getting a kidney failure or injury, and you start getting any of those signs and symptoms, please better rush to the hospital for management. And in the next segment, before we break off, Dr. Felix will take us through how you could do some home management or first aid before you rush the patient to the hospital, and also take us through some of the assessments they do in the hospital to confirm or diagnose you have a kidney failure or challenge. Thank you. Let's get back. Health is wealth.
Lamine Yamal, Antoine Griezmann. La Liga comes to Star Times.
A wild celebration!
The big stars, the tiki-taka football, Real Madrid and Barcelona live in your living room.
Real Madrid, a team of dreams!
Catch all 380 games live and in HD on Sports Premium Channel 259 and Channel 246 starting this August 15th. Subscribe to StarTimes Classic or Smart Bouquet at 36,000 Uganda shillings to enjoy the football experience affordably. StarTimes Football and limited passion.
Is wealth. We'll be back, dear viewers, from that short commercial break. It's still the Daktari Show, a health educative program which I see on National TV every Thursday from the hour of 11 to noon. And today, those who have just joined in, we have Dr. Felix from Sick Care, who is taking us through kidney failure or injuries. Things in the first segment, he took us through what kidney failure is, where he told us it could be an injury to the kidneys. Then he told us of the things we could be doing in the communities which could put us at risk of getting these kidney failures. And also before the end of the segment, he took us through some of the presentations, how you could know you have a kidney failure. The doctor will be back from that short commercial break. To ask on, or maybe to pick on, could there be some other signs and symptoms or presentations our viewers could get in case they are suspecting a kidney failure or injury?
This is just to make it as simple. When the kidney failure is mild, especially the acute kidney injury, we may not have signs and symptoms that one can easily pick out. One is asymptomatic. However, when it progresses and it's becoming a chronic kidney disease, this is where you are now able to pick up these signs. As signs like you can have abdominal pain, you can have abdominal swelling, you can have nausea, you can have feeling of vomiting, you can have fatigue, you can have a generalized body weakness, but then the major thing, you will have swelling of your body. When we go into the complications, one can start developing a confusion. That is in that level we call it now, one has reached acidosis. That means the wastes are not being removed from the body. Confusion can come in, headache can come in. These are now symptoms that affect the central nervous system. Then I also talked about we can have symptoms related to urinary flow. One can either have a poor stream of urine, you're passing urine, it can't go far. Then we also have, one can be having dribbling of urine. Means when you're urinating, instead of the urine going like 1 meter, it just falls at your legs and maybe wets even your clothes. Then we also have instances where you have a feeling to pass urine, but you go to a place of convenience and there is actually nothing coming out. And then there are things we talked about, like when you're having excessive thirsts. These are pointers that you could be developing acute kidney injury, which can progress to a chronic kidney injury.
From your presentation, Doctor said, to get these presentations or signs and symptoms, in the early stages, it's difficult to realize. These signs or manifesto will show up in the later stages. Before we go to the home management, how could you recommend? Could you recommend maybe every year kidney checkup? Or
it's important. At C-Care, we do what we call also a wellness check. This we check your organ. We do the kidney function test. We are able to do a urinalysis. We are able to also do things like liver function tests. All this help in screening for kidney injury. Preferably, one has to be doing this annually, such that you're not shocked about kidney injury that has started setting in. Remember, we said over 90% of people are not aware that they've started developing kidney injury. But those are few things we are able to do, but there are other investigations I can be able to add on.
However, key to note the viewers is that every year we should do a kidney test. Now maybe, doctor, we assume someone as maybe in the later stages they've gotten these signs and symptoms. They are maybe having swollen faces, swollen limbs, they're having the dizziness, headache, fatigue. There are some home remedies they could do in the community or first aids before rushing to the hospital. Then, before even addressing that question, is a kidney failure or injury an emergency that when you realize this, you have a challenge that you have to immediately seek care?
Acute kidney injury is an emergency, because the earlier we intervene, the better for our patient. Because when we look at acute kidney injury, we are going to run tests, and there are tests we do to assess functionality, like we look at the creatinine levels, and then we shall look at your urine output. It's easy for us to reverse acute kidney injury if you immediately came to the hospital within 48 hours. Or if there is a delay, then it should have been not beyond a week. Beyond a week, the spectrum continues. Acute kidney injury will then progress to chronic kidney injury. Means the cells of the kidney will start to die because of the insult that is on them.
You have told us it's an emergency. Then, since it's an emergency, what maybe are there some first aids our viewers could do in case they encounter or come across someone who could be suspecting a kidney injury?
There are things we can do if you come across somebody and you're suspecting that they have kidney injury. You've met somebody, they are swollen, the face is swollen, the limbs are swollen, maybe they've collapsed on the way. It's important. This is a general first aid management where we have to protect the ABCD, we have to protect the airway such that this person does not suffocate and die. The breathing, could there be anything blocking it? We talked of circulation, excessive bleeding. If one is excessively bleeding because it predisposes to kidney injury, you should see that you get a cloth, a clean cloth, maybe your shirt, and be able to tie in order to control this bleeding, because this will lead to hypovolemia, which is one of the leading causes of kidney injury. After you've done that, it's important that then you reach the nearest healthcare unit before you're being transferred to a higher setup. These are some of the things you can do, but importantly, you need also to call for help from people nearby you or from your family members to come, and then you rush this patient to the facility. You can bring a sick care, then we shall be able to assess this patient.
He has told us it is an emergency. How? Because some people who have given us form of the first aid they could do. They could do the first aid, someone gets a bit better and they remain relaxed at home. However, he has told us it's an emergency. In case you do the first aid and it relieves the pain, please still you have to run to or rush to the hospital for this specialized management. Then, doctor, we assume, because now we don't have the patient here, someone has gotten an accident, maybe they have lost a lot of blood in the process, we assume they have gotten a kidney failure, or maybe they were fighting and they had fists or blows in the abdominal regions and have gotten a kidney injury or failure. When these people come to the hospital, or maybe at sick care, how do you always assess to confirm they have a kidney failure?
Thank you so much. For us to assess for kidney injury, we do what we call a physical exam. We take history. I will ask you questions. When did the swelling start? How do you feel? Is there the abdominal pain? How is your urine? How are you passing it? Is the output okay? How many times are you moving? How is the frequency of your urination? All this, actually 75% of history taking is able to let us have a clear picture that I think we are dealing with a kidney injury. Then there are things we proceed to do, which we call physical exam. We then definitely have to check the degree of the swelling, how it is. We then definitely have to check, is your blood level enough by just looking at your conjunctiva, looking at your tongue, looking at your palms. These are quick things a doctor will be able to do. But then there are lab investigations we are able to carry out. Most importantly, it's urinalysis. Urinalysis we are able to do it, and here we are interested at the proteins that are in urine. We are interested to see whether there are blood cells in this urine. We are also interested in seeing if there is a protein we call albumin in this urine. Then we are also we are interested in looking at this urine. Could there be any signs of infection? Urinalysis is a very important investigation in kidney injury. There are other investigations we are able to do. We talked about them. We are able to do a renal function test. And majorly here we want to look at the creatinine levels. If the creatinine levels are beyond 0.3 milligrams, for us, if they are raised, let me put it in a simpler word, that will already indicate to us that there is an injury to the kidney, especially above 48 hours. We will also be interested at the measurement of the urine output. If the urine you're producing in every hour is less than 0.5 mils of your weight. For example, if you're 60 kilograms and you're producing less than 30 mils of urine, we shall start to think you're developing acute kidney injury. There are investigations we shall do, but these help us to rule out the risk factors. For example, we have to do your blood pressure checks. We have to ensure that you do not have blood pressure. We also have to do random blood sugar to ensure that you do not have diabetes. Then we are able to do imaging tests. And these imaging tests majorly, if you remember our anatomy, they we do an ultrasound scan of the abdomen. But for this case, we want to look at the structure of the kidney. If we look at when there is a damage to the structure of the kidney, then we can be able to conclude that you could be developing a kidney failure. We are able also to do ultrasounds where we look at the kidney, ureter, and the bladder. Then, just as I told you, this ultrasound is also able to help us look at the prostate. Remember, we said if the prostate is enlarged, it can block the outflow of urine. Then also we talked of the pelvic masses. We are able to get all this on abdominal and pelvic ultrasound scans. Maybe if we needed a clearer picture, we're able to do them on CT scans. And these are investigations that we can be able to do and can help us in knowing whether one has a kidney injury or not.
Indeed, you have given us a feel of how it's done in the hospital to confirm or assess whether a patient or a client, how you call them sometimes, they have gotten a kidney failure or injury. Then, Doctor, we assume again this person has come to you, you have done your tests, and you have confirmed they have a kidney injury. Like key to note, you told us in the urine there should not be proteins, there should not be these blood cells, and you find out they're in the blood cells, and you have confirmed this person has a kidney failure or injury. How do you always manage these people?
Thank you so much. Management of kidney injury is according to the risk factor, and it is according to the cause. For example, we looked at the causes. If it is dehydration, immediately we have to correct the dehydration. If it is the blood, if one has high blood pressure, hypertension, means we have to give antihypertensives, which will help us have a normal blood pressure. When one has a predisposing factor like diabetes, we have to give them anti-diabetics. Drugs that manage kidney failure are basically drugs that help us to balance our blood pressure. I can also be able to tell us that the management of kidney failure is according to levels. This we are able to do in acute kidney injury, which is reversible. If one has lost a lot of blood and it is what is bringing the kidney injury, we definitely have to do a blood transfusion. If we have, if one is swollen and is having a fluid overload, we then have to give what we call antidiuretics. These are medicines that help remove excess water from the body. This is the management we give for acute kidney injury. However, when we look at now the chronic kidney injury, it's an expensive form of management, because when we go to chronic, it means we are failing to have a water balance. We are giving drugs that should remove water, the diuretics, and one is still swollen. We are starting to have acidosis come in place, means the kidney is now unable to remove hydrogen ions from the body, which are in the urine. And then also we are having things like urea building up, because the component of urine is urea. One will start developing uremic encephalopathy. One will start developing uremic pericarditis, will start to develop complications that will affect the heart. These complications will also affect the brain. in these cases, we now have to do what we call renal replacement therapy, RTT. In simple words, this is what we call dialysis. I think all of us know how expensive dialysis is. For you to maintain a patient on dialysis, you need averagely to have around 20 to 30 millions. Dialysis, these are machines we are able to connect on your body, and then they help perform the roles of the kidney, removing the excess electrolytes, removing the excess acids from your body, because the kidney is no longer able to perform its role. This management is at a higher level of care, majorly at our national referral hospitals, and we know this is Mulago. At the moment, if we look at the West Nile region, we actually do not have a dialysis machine, even in our regional referral. But the good news is, as C-Care, we have these services at our service points like IHK, and we are able to help out. Maybe before I go back to my dear moderator, one of the other renal replacement therapies I think you've been waiting for is the kidney transplant. A kidney transplant, if we all remember, Uganda did its first kidney transplant in December 2023. And I should say congratulations to Uganda, because this was our very first one. And this treatment for end-stage renal failure is very expensive. For you to undergo it, it's averagely about 90 to 150 million. We have seen circumstances where people have to fundraise in order for us to carry out a kidney transplant. So I've tried to paint a picture of management at a lower health care as we progress up to management at our national referral hospitals.
And also the viewers are picking a clue of how they always manage patients who have these kidney failures or injuries. However, key to note, if it progresses to chronic, you will need to go for dialysis, and he has told us it's quite expensive, over 20 to 30 million. So meaning prevention is better than the cause. So now, doctor, how can the viewer outside there prevent or keep himself safe from getting a kidney failure or kidney injury?
We are all able to prevent kidney failure, because we have the choice in our hands. We looked at the modifiable risk factors. For example, smoking. This is behavioral. It's very possible to stop smoking. Only that when one is to stop smoking, these are addictions. You can't stop in one day. We encourage cutting down. If you were taking like 6 sticks per week, we encourage that you cut down hopefully to 3 sticks, maybe in a period of 3 months. Then you challenge yourself to cut that to again 1 stick. In the long run, in a period of 6 months to 1 year, you would have stopped. That also applies to alcohol. Then the other things we are also able to do to prevent us from having kidney failure is our diet. Because I'm talking of diet because this is where we have salt a lot. It's recommended that you should put a little salt. And however, if you've started to have acute kidney injury, we recommend that probably the salt you should take should be just half a teaspoon in your food, and this will keep you healthy. For water, we realize that dehydration causes this. For drinking of water, we do encourage that one takes about 4 to 6 glasses of water daily. This is about 2 to 3 liters. This will keep you hydrated throughout the day, and we will protect you. The other things we can also be able to do is to avoid self-medication. We already talked of drugs that are able to cause kidney injury. We talked of painkillers like ibuprofen, which belong to NSAIDs. Then we are also talking of other categories of drugs which are used for treating infections. For example, gentamicin. These drugs also cause damage to the kidney, or we say they are nephrotoxic. We are also able to, we should avoid contrast. Contrast, I mean these imaging modalities, investigations we already talked about, like barium swallow, barium meal, things like stereosalpingograph to check whether the tubes are blocked or not. The body usually has to eliminate this. These are some of the things we really need to do. I also want to encourage that kidney disease is in a broad category of illness which is called the non-communicable diseases. Remember, the other things that predispose are already comorbidities. A person who already has hypertension, a person who already has high blood sugar levels. That means I'm going to bring in an important bit of reducing oil in the food we usually eat. Then also reducing the sugars in the foods we eat. I also want to encourage exercises, which is a very important factor also for us to prevent this kidney injury. Exercises I will emphasize on. Daily walking is good enough for all of us. Daily, if you can walk just for 30 minutes, that's good enough. Thank you so much.
One more key factor I noted in that presentation, that it's non-communicable. Meaning, if we have someone in the community who has a kidney failure, we should not isolate or segregate these people. Maybe doctors, we are coming to the end of this program. What's your key package you are giving to the viewers as we conclude the program? I
just want to emphasize on prevention, which can be primary prevention, which is very important. The health education we have just given you on lifestyle modification is really very important. Then we also need to look at the secondary prevention. I want to encourage regular screening. We already talked about it annually. This helps us do early detection. And when we do early detection, it is easy to do early treatment for kidney failure. As we sign off, I just want to say that as kidney failure, it's also able to complicate, but the complications can usually be managed. I also want to conclude by saying that the other management we didn't talk about is palliative. If one is not able to foot the cost, that means we have to come to the terms and just manage the complications that have come in place. To the facility CCare, we are grateful you giving in your personnel to come and educate the viewers about kidney failure. I've been your host.